Hello, everybody. I thought we would talk about when it's a good idea to go to urgent care and when you don't need to go to urgent care. This is tricky. Urgent care has its value, but it is very much overused. And with pediatrics in particular, most of the people working in urgent care are not pediatric trained, they're adult trained. And many times they're not physicians, they're nurse practitioners or PAs, and their main focus in their training was on adults. So we have to be very specific about what we're going to urgent cares for. So the main use for urgent care is obviously for something urgent. That's the name, that's the reason. So what, as a physician, would I define as urgent? I love urgent cares for things like stitches. That is something that you don't need to necessarily hop to the ER for and crowd the ER. And they're very capable and they have a lot of practice doing it. They're also great for splinting for broken bones. And you might have to look up which urgent cares have an x-ray machine, but they can bridge that gap between getting your child a splint and needing to go to the orthopedist, especially if this happened late in the afternoon when your child was playing sport and something happened, the orthopedic office is closed. That's a great use for urgent care. Other things, the things that I hold back on for urgent cares, if it's a weekend, and people always bring this up to me, like, well, it's the weekend and you're not open. There's not necessarily a need to rush in just because the clinic is closed. I know a lot of people have fever fear. And fever is just a natural response to being sick for kids. And for children, and please don't apply this to adults, this is a very different world that we live in. For pediatrics is, 102 fever is not emergent. It's a response to being sick. The body is responding to illness. So, it's not necessary to get it to go away. You can give anti-fever medicine to make it drop. And the goal is really just to drop at a point to make them more comfortable. The goal is not necessarily to make it go away. Fever is not catastrophic to children. It's not harmful. It may be uncomfortable. That's different. It's not harmful. Temperatures that are harmful, we're talking 106s and higher. So if your kids are having normal fevers, 101, 102, 103, and even 104s, those are normal common temperatures for illness. And that's the body reacting to being sick. So if this is happening at nighttime when the clinic is closed, on the weekends when the clinic is closed, it's not a necessary run into an urgent care, because often you run in too quickly. And what I find happening in some urgent cares, and I'm not going to say that every single one is the same, but in many of them, especially the ones that are more geared towards adults, is that they're swabbing for everything. They don't really know what to focus on, so they swab flu, RSV, COVID, strep, or sometimes they have these super swabs that will swab for any virus and bacteria, and it's just a very confusing thing to see. And then sometimes these swabs come back negative and they're still giving out antibiotics just in case. And then what I come to find out later from the family is the child's not getting better and they've been on antibiotics and sometimes horrifyingly steroids too. And the reason the kid's not getting better is it was viral to begin with. So there was an unnecessary prescription given, or prescriptions, and the child had a viral illness and didn't need it to begin with. So, all in all, most often, if we run to the urgent cares just for fever alone, I think that that's probably not necessary, and that's when you could text your physician, your DPC doc, and say, hey, what do I need to do? You don't need to go in for every illness. And if you're having a hard time getting in with your pediatrician, and this comes up a lot in this area, and so maybe your pediatrician is full for the day and they say, well, if you need to be seen, go to urgent care. Then you don't have a great pediatrician maybe, and you need to be looking for someone who has more availability. That's the beauty of something like direct primary care. I would first question, is it something you need to be seen for? Is it just a cold? Is it the first day of fever? The first day of fever, I tend to like to sit and see how things go, because, you can swab too early for things and it might come back negative. But, the beauty of having a practice like DPC doctors do is we always are going to be available to see you if you want to be seen. And not just say, go to urgent care. I think that's invaluable to a parent, and ends up with poor care. Other things that are urgent that may be valuable, what if your child is having like an asthma attack? Well, that's kind of borderline. Do you go to the emergency room or do you go to urgent care? It really depends. I don't mind the urgent cares that have more pediatric training, because they're going to be trained to do the asthma protocol, and give 3 back-to-back treatments and monitor oxygen levels. That would be a good use of urgent care. And there are several peds-specific urgent cares. Again, I avoid the big super swabs in any situation. I just don't like them. You find unnecessary colonization and then they're trying to treat it. But I think it's helpful for things like your breathing issues that can be managed with a shot of steroid, some back-to-back nebulizers, calm the breathing down, monitor for a couple of hours, and then be able to go home. Other things, concussions belong probably in the ER, because if and when you might need I'm going to step inside, if and when you might need a CT scan, which hopefully you do not, the ER is the proper place for that, and you're probably going to need to be monitored. Those are something we typically don't want to just wait until, your pediatrician is available. Hopefully you've talked to your pediatrician about whether you need to go in or not, but if you do need to go in, it's not something you wait until Monday to be seen for. Strep throat. So, strep throat, you can swab too soon. So, fever spikes or sore throat starts. I mean, if it's like within the hour and I swab, it certainly can be missed. The swabs are somewhere between 95 and 99% accurate. We do have backup cultures, but in general, we kind of want to wait, let the symptoms settle in, because many colds start with sore throats. So it's helpful. You may even prevent getting a swab in general if 24 hours into a sore throat, we find out, oh, there's the congestion and the runny nose, and the cough. So you might not even need that swab 24 hours in, but a lot of parents have this need to be like, I want to nip it in the bud quickly. That's not always going to happen, because I might end up telling you, well, I don't know, it's the first few hours of illness and I can't predict that this isn't going to progress. So just be mindful of the fact that most urgent cares are geared towards adults. Most urgent cares don't necessarily have doctors there all the time, and that they do have what we call mid-levels, so nurse practitioners or PAs. And to try to avoid this concept of multiple swabs at one time. If those swabs are negative, really, there's not a need for antibiotics just to cover something. I mean, that's just poor care, I think. So I really would encourage you to wait out symptoms if it's waitable, and not to be scared of fever. And, you know, the beauty of direct primary care, you can text your physician to say, is this something I really need to be seen right now for, or can I wait to see you? And I would say the majority of the time the answer is going to be yes, you should wait to see your physician. So I hope this helps. If you have questions about, you know, what to do and when it's useful, I mean, I'm sure there's not every scenario I could think of, but feel free to reach out. Okay. Have a great day.